Hi, I'm Dr. Christy Smith, and I'm a chiropractor in Seattle, and this is my video about knee pain. To get you oriented, this structure that I've drawn right here represents the femur, which is the larger top bone here above the knee. The two bottom ones, that's the tibia and the fibula, and on here that would be tibia here, and fibula is outside around there. So common injuries we're going to talk about, the first one are things that get sprained, which would be ligaments. The MCL is on the inside, so pain kind of over in this area. The LCL, which would be on the outside kind of over here. Then you also have the ACL and the PCL, which form kind of a nice little cross, sort of like this. So this one kind of wraps in front, that's the ACL, and the one behind is the PCL. Those basically help stabilize the bones so that things aren't sliding around. The next thing we're going to talk about are the muscles, and muscle injuries are called strains. So muscles, we've got the quads, which is named that way because there are 4 pieces to it. You've got basically 2 on the outside and then 2 stacked on each other. Behind the knee, you've got hamstrings, which come across here, and then you've got the calf muscles, which come across back behind there. So the muscles in front, the quads, have an area that becomes a tendon, which connects muscle to bone here, and that's above the kneecap or patella, which is right there on my lovely model Jess. And then the patella kind of floats in this tendon, and then the bottom part of the tendon attaches the kneecap or patella right here into this bigger bone here. If you get an injury in this area, which you'll feel kind of in through here a lot with stretching, that's more of a tendinitis. So ligaments, sprains, muscles, strains, and the tendon would be tendinitis. The other thing you have inside the knee are 2 big cushions called your meniscus. You have 2 of those, and if you have an injury to those, they tear. You may have a small piece that breaks off, or there may just be a tear in them, and that's a cartilage. So when you're running or walking, you may feel a catching, a popping, a very sharp pain on the inside, and that could be meniscus damage. The only way to know these for sure is if you have an orthopedic examination by a chiropractor or an orthopedic surgeon or another MD. And the other way to kind of make sure that what you have going on is getting an MRI, which will measure all these tissues and you'll be able to have a visual of those. One other thing we're going to talk about is a common running injury, and that is basically a fascia out here, runs along the side of the leg here, starts up in the butt, comes all the way down across the knee and attaches into here, and that's your IT band. And that's a whole other story because it's not any one of these other tissues we talked about. It's its very own thing. It feels kind of like a burning pain and will often be very focused right in through here. Every time you bend your knee, that gets irritated. For more information about knee pain and possible therapies, please visit my website, drchristysmith.com.